Thank you for watching our video series. Today, it's a very important topic we're going to be talking about is how to manage the workforce in the midst of the coronavirus or the COVID-19. I have Armando Diaz. He's a certified professional health and safety trainer.
Yes.
Thank you. I don't want to age you. I know it's been over 20 years you've been doing this. Thank you for joining us. So I want to talk a little bit about this virus. Number one is I think in the workforce, we need calm. That's one of the most important things that we need to consider. The biggest casualty we're going to see when this is over is going to be the emotional and personal trauma in the workforce. There's too much information overload. It's producing panic and fear. You know, one of the passages that I thought about recently in the book of John says, if you know the truth sets you free. So Armando, I want you to set us free today and give us some truth.
Okay.
Let me ask you this. Let's talk about this. What is the coronavirus?
Javier, it's a strain of SARS and MERS. And SARS is severe acute respiratory syndrome and MERS is Middle East respiratory syndrome. Both of these viruses were something that came up several years ago, and the coronavirus is a derivative of it. And at this time, we understand it was identified in December in Wuhan, China.
Okay. And what are some of the symptoms that people have when they have this coronavirus or COVID-19?
Simply put, it's fever, dry cough, and shortness of breath, and fever probably being the primary symptom.
Okay, we talked about some of the other issues that we see that not just somebody that sneezes or has something is a carrier, but there's distinct symptoms. So not to be confused with what we see in the just with the average cold. So what can we do to help not spread this disease?
Well, first of all, there's coughing and sneezing etiquette that really needs to be expressed to workplace employees. You know, if you have to cough, you have to sneeze, you don't want to do it in your hand, you want to do it into your arm. Also, too, the importance of disinfecting surfaces. If for some reason you come in contact with your nose or your mouth and some of your body fluid is on your hands and you touch a surface, that would be considered contamination. So from that point, somebody else touches it and then they come in contact with the three primary routes of entry: the eyes, the nose, and the mouth.
Okay. And I know there's a lot of good information out there by either the CDC or OSHA. Tell us a little bit about what the CDC is saying.
The CDC has 8 specific guidelines. Really simple. If you're sick, stay home. Making sure at work that we're practicing good cough and sneezing etiquette. Hand washing is really a key to success in this issue. 20 seconds minimum hand wash. Also avoiding close contact. Not touching your face, and keep in mind the eyes, the nose, and the mouth are the primary routes of entry. At work, be sure not to share personal items, for example, dishes, utensils, or even a towel, a personal towel that you have. Offering no-touch trash can and soap dispensers. And lastly, if you're sick, see a doctor, and the CDC is asking that you contact your doctor before you go to the office. They'll give you some specific instructions.
Okay. And what are some of the OSHA guidelines that are out there?
Boy, I'll tell you, OSHA has an aerosol transmissible disease code. It's 5199 of the Title 8 Safety Code. In that code, it makes specific the employer's responsibility to perform hazard assessment and provide training. It also talks about allowing flexible work sites like working from home or flexible hours if it's possible. Maintaining social distance, at this time it's 6 feet. Postponing large meetings or conducting them through the internet. And lastly, providing washing facilities with soap and water.
Great. That's been some great information. You know, I want to kind of conclude with just talking about a little bit about our nation. You know, our nation was built on faith, faith in God. Even our dollar bill says, in God we trust. You know, the scripture says that not one sparrow falls to the ground unless God knows it. So I think we need to remember in these trying times, our faith in God is what's going to get this country through it. Thank you for watching this video series, and I hope this has been helpful.